All right.
Cool.
Dr. Joe.
What's going on, fellas?
Back again.
Yes, sir. Yeah.
In our inaugural three-mic podcast. Mm-hmm. This is awesome.
The technical marvel that you guys have pulled off here.
Yes.
Well, he's the technical marvel. I seriously just default to everything technical, mechanical. Nico's the guy.
Yeah.
So, dude, appreciate you so much.
Awesome.
So, Dr. Joe, we were just talking about filling space.
Mm-hmm.
So for those out there, we're just talking about how we all tend to kind of, maybe you not as much, right?
Okay.
But Dr. Joe, me, Ryan, will get a little musical when we're just kind of walking between clients, fill the space.
Yeah.
You're walking, you just go, do, stuff
Yeah, I guess
like
I don't really do that. Maybe I should start.
Nico has more inner peace
Yes.
than we do.
Congratulations for not having crippling social anxiety. I'm proud of you.
Yeah, exactly.
For the rest of us over
I
here.
cope in other ways, don't worry.
I can't hear my thoughts. So, I've actually often, I wouldn't say struggled is the word, but I've thought about the fact that, and you and I have talked about this a lot, I've been trying to reduce caffeine consumption for a long time.
Oh, okay.
Because I kind of would just prefer to drink less caffeine. I like the way caffeine makes me feel, but
Sure.
there's benefits as far as maybe a slightly better sleep if you just reduce caffeine consumption,
Yeah.
right, to a certain point,
Mm-hmm.
right? And everyone's a little bit different in how they respond to caffeine. Mm-hmm. But I've found that I feel and maybe this is my own perception and my own expectation of myself, but as a trainer and being in a position to facilitate an experience over the course of an hour, mm-hmm. I find myself almost feeling self-conscious about being too mellow. Right? Like if I'm no caffeine, but I had a good night of sleep, I might not have this little buzz to me.
Right.
But I'm good. I have good energy, and I'm just a little more mellow.
Yeah.
Maybe less likely to fill that space, more just relaxed, chill. Mm-hmm. But I have this feeling maybe that, I don't know, am I not bringing it that same way? Is this not energetic enough? Is this not enough of an experience for my client? Because I think in some ways our professions are unique in the sense that we're part of what we do is facilitating an experience for the course of an hour. Right?
Sure.
Like your brand over the course of an hour. Have you ever had that thought before?
All the time. And what I've remarked upon is the volume of patients I've had over the years, as well as the variety. And I think you guys probably do this innately without realizing it, is that you are going to change your approach to your client based on what they need from you.
Yeah.
Because
absolutely.
as you said, basically, the product we offer is quintessentially part of us.
Yeah.
Because exercise is not a novel concept, but how you connect with somebody and sort of motivate them to come to the gym or come to therapy and have that positive experience comes along with their connection with you. And I say a lot of times, like, it's not the responsibility of a client or a patient to change at the whim of the provider. It's the other way around. Like, we need to alter our experience based on what people need. And so I've had folks over the years. I'm a pretty jolly, jovial guy for the most part. You know, I mean, I'm the last person to talk about caffeine consumption, let's be honest.
Dr. Joe has a private delivery service from his wonderful 2 children.
Yes, my kids drop in every couple days, which is nice, and just make sure to keep me nice and buzzed, which is perfect. But
with caffeine.
Thank you for the clarification.
Yes.
I have to talk to my children about their
He's our tech guy and our legal guy.
But I think for the most part, I feel like we need to bring the energy, because if someone comes in and they're having a tough day and you go, yeah, I know, my day was pretty bad too. Like, that's not doing anything for that person. They're not going to merely be engaged with you. However, I think, there's a bit of a skill set to be able to read your client or read your patient and think, this person doesn't need that from me right now.
Yeah.
Right? The mellow approach is what they need. And so I've had patients over the years who don't need jokey, happy Joe. They need sort of straight to the point and serious Joe. And I will say, I get uncomfortable during that session because I feel like I need to fill the space.
Yeah.
That's more of a me problem than a patient problem. And so as long as I acknowledge that and say, okay, I don't need to do this. What this person needs, I am delivering to them. And they get better and they go and they come back and see me for something else.
Yeah.
So, I suspect you probably already, both of you, do that already to some capacity. I guess to your point, where's your starting line? Do you want to start kind of being more mellow? And as long as you can sort of click it up as needed, then you're good.
Yeah.
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 I think I default to a little more energy, and then I'll dial it back. I don't know about you.
So start with more and dial back.
Not crazy, but I'll start more into the session and energetic, and then I'll dial it back as the session, if I'm reading the person, to be a little more chill that day. Or like you said, it just might depend on the type of person and their personality.
I think that makes more sense for trainers.
For trainers.
Right.
Yeah.
It's probably if the average, like a spectrum of energy during a session is 1 to 10, 1 being totally chill, 10
Sleeping.
being bouncing up like Mike, right? Probably the average training experience is more like a 6, a 7, where probably PT, maybe you have more clients where you're doing the manual therapy, right?
I feel the space just to mostly distract them from that, because typically if I'm doing manual, it hurts. It doesn't feel that great. If I'm trying to release something, or I'm really working on a knot or whatever the case may be, that doesn't feel all that great sometimes. And so I try to fill that room mostly just to sort of distract them a little bit and get them through that session.
Okay.
But I think the biggest difference between how people encounter you versus me is that, people come to you guys from a position of wellness for the most part, right? They're making the choice to come see you for their well-being. Nobody chooses to see a healthcare provider. They have to. They're hurt. There's an illness or something that's sort of affecting them, requiring care. And so I think our starting places are different. But that's not to say that one approach is better than the other, because I've worked with many much more stoic therapists than myself who are fabulous.
Yeah.
Right? So everyone just kind of has to find their line.
Yeah, and just what works for them.
Right.
So speaking of pain and you kind of distracting them from that, obviously right now my dad is seeing you for his knee replacement. Got it almost 3 weeks ago, I think. So one of the things that I think is fascinating is just the idea of working through pain, and there's such a wide array of opinions on this, right? To
Very
like
much.
what's detrimental pain, what is, hey, work through it kind of pain, right? So, and especially with something like, you think of a knee replacement where very quickly you have to start getting them into more knee flexion, right? Like, so bending that knee more,
And
right?
straightening. I mean, just
straightening,
keep moving. Absolutely. Yeah.
So I find that fascinating, because that's not the ballpark of trainers to be working through really difficult pain. We might occasionally say like, hey, use your intuition. Is this manageable? Is this an okay work through type of thing? But you're actually having to encourage people to accept a certain level of significant discomfort.
Sometimes, yeah.
So what is the actual mechanism going on there when you would do something like moving through flexion or extension on the knee? I mean, because typically I would associate pain with bad, right? Body saying stop, but you almost have to do that.
Right.
So what's like the layman's of what terms of or explanation of what's happening?
Yeah, I think it's a question of what the pain driver is. I try to, I think a lot of what we need to do in therapy is help connect people to their own bodies and their own symptoms, kind of make it easier for you all to work with them down the road to say, okay, when someone says they have pain, what does that mean? Because one person might say pain is in my muscles are getting sore doing this lift. It's like, well, that's good. We want that, right? Versus something that's more acute and sharp. And you're right. I mean, when someone has a sharp pain during a session, for example, maybe something's gotten stretched too much, and we don't want to do that. And, the whole sort of pain and torture misnomer about therapy, I always kind of chuckle about, because it's not, most of the time, we're really not trying to make people have those kinds of symptoms that you're describing. I mean, if anything, that's usually a point where we say, okay, we don't want to push through that. A lot of times I'm trying to encourage the same kind of soreness that you guys are looking for. But there are some instances where we know that we have to try to move through these painful symptoms. And the two most common times I could think about that with my patients is one, a knee replacement. And secondly, is frozen shoulder or adhesive capsulitis. Okay. And in both those instances, the things that are driving pain are a lot of those soft tissue barriers, the joint capsules and ligaments and those sorts of things. And with the knee replacement, you're also thinking about the additional trauma of the surgery, because it's a trauma. I mean, you're having metal jammed into your thigh, into your shin. There's nothing.
It's totally wild.
Yeah, it's
crazy.
And when I first started working, the stems that they would put in people were that long, and now they have ones that press fit and they're really snug.
Okay.
So
it's amazing.
Technology
it's crazy.
it's incredible. It's such a fascinating thing to see. And I always, if I have a student, I always encourage them when they're in school, I said, go, try to get into an OR and see a knee replacement, because you will have an acute understanding as to why these people are so painful. because it's a violent surgery. Tables shaking and there's hammers and saws. I mean, it's no joke.
You can YouTube it, right?
Absolutely.
I think I've heard that.
Yeah,
I personally haven't watched it.
Yes,
but.
some patients have dissuaded themselves from having the surgery because of seeing it on YouTube. And I mean, whatever's in your heart, I completely understand that.
Yeah.
Is it more machine now though, or no?
No, it's still pretty. It's still pretty much. I mean, the way that they settle on like the size of the prosthesis has sort of evolved over the years to be a bit more specific, a bit more technical. I mean, I remember following a surgical doc, and he basically would just put the X-ray up and put a stencil on the X-ray and sort of drew circles on it. I mean, so those surgeons are engineers as much as they are physicians.
Wow.
These days they could be a bit more specific, but they're still, at the end of the day, you still have to physically extract out the old joint and you have to press in the new one. So, I mean, they're working hard. For sure.
Yeah. It's crazy, right?
But
you walk into a room and there's a buzzsaw coming out.
I mean, pretty much.
Yeah.
It looks like something out of a horror movie if you look at that OR table. But back to your point. So in those instances, we know what's causing that pain. And we know that tissue is oftentimes stubborn to move. However, in those instances, we also know through research, through anecdotal evidence, that those are times where pushing through those painful symptoms is sometimes necessary to achieve improvement. Now, with the thing I always have to balance with that is we still want to encourage movement throughout the day. And if I wreck somebody at 9:30 in the morning and then all they can do is lie in the recliner until 7, well, I'm not helping that person, right? I want to get them moving enough so they can continue to do their stretching, throughout the day. Which is why I tell people that surgery is hard to recover from, and so you have to be ready for those first 6 weeks.
The knee replacement?
Those first 6 weeks are going to be a slog. You got to be ready for it, and you have to work hard.
Yeah.
It pays off in the long run,
right?
Because it's good to great results kind of uniformly with that surgery. Yeah. And frozen shoulder is the same thing. It's a self-limiting condition that kind of mostly goes away by itself after about 2 years. It's still kind of an enigmatic diagnosis. However, you can have some permanent dysfunction with that if you don't treat it. If you have therapy, we're talking about months as opposed to years of dysfunction, but you have to work at it, and it's not easy. But we know what's causing pain in that instance, and we know how to apply force in such a way that we're only targeting the tissue that's just being stubborn to move. And that just comes along with some time and some experience to know kind of when's the right versus when's the wrong kind of thing.
Yeah.
But in more instances than not, I'm thinking the same way you guys are, where if someone's getting that kind of sharp soreness, well, I don't want to push through that. We got to think about why and alter our approach.
It seems like there's a common theme, because this has been, and I'd love it if you corrected me on this if I'm off, but my philosophy, just having spoken with many physical therapists over the years, worked with physical therapists, right? My philosophy as far as working through discomfort has been a combination of intuition, like what does the client feel? Is it something that feels like it's going to be very detrimental? Does it feel like something they can work through? But it's that balance you were just describing of, hey, if you have arthritis, if you have some sort of structural issue, atrophy is not a good thing, right? Less insulation for that joint, less support from the muscle is not going to be a good thing, right? So you almost have to find that balance of stressing the area, hopefully in a way that is going to build up the muscles and the surrounding tissues without reaching that point of diminishing returns, right? As you were saying, like, hey, if I make it so you can't walk for 7 hours, right? So you're building, and there may be some stress or discomfort that's later that day or the next day, but it's done so in a way that hopefully you get that trend.
Yeah.
Right? Is that kind of the sweet spot?
No, I think that's a nice way of putting it. I think you want to teach resilience, and you want to teach folks that, moving through some discomfort doesn't mean that that's going to be something that's permanent or damaging. Because I'm sure you've gotten that question before.
Yeah.
I get it all the time. Am I hurting myself? Am I injuring something? And so the more that you have folks sort of understand that when you move in something sore, it's not going to be a permanent issue, and to have that intuition, you only get that intuition from experience, right?
Yeah.
So sort of understanding what's been done before and how it affects you. And so trying to find that sweet spot. So no, I think you're on the money with that.
Yeah, and there's a popular fitness influencers out there, like the knee over toes guy. I actually have a couple of his little tiny handouts, and one of them says something like, muscle burn without joint pain equals construction. Joint pain without muscle burn equals destruction, right? And I'm sure that's not like a end all be all, right? And some would say, like one of my PT friends in the area, he says, hey, under a 5 is functional discomfort, right? So you have these different schools of thought, one saying, hey, don't ever work through joint pain, and you have another that says, if it's a functional level of discomfort, something, and I would probably qualify that to this, like what you can work through, what's going to be productive after the fact. Would you say that's kind of how you would approach it, just not the extremes of either, right, but somewhere in between?
Well, I think that comes from for just having the opportunity to sort of see where someone's at and meeting them there, like we talked about before, because some folks might be more on the end of being a bit more intuitive and understanding how to move, and some folks aren't. And so, I think somewhere in the middle is probably of those two frameworks. I mean, I could see where they're coming from on both of those. Yeah,
like maybe, for example, shying away from the joint discomfort would be more appropriate if you don't have a structural issue, right? Like, for example, you don't have arthritis, you don't have a knee replacement, right? So maybe finding a way to work out in a way that doesn't facilitate pain may be more prudent for someone like that. But if you already have a structural issue, like arthritis, there's been a change to the soft tissue, the joint itself, or the surrounding area, it's probably going to be almost impossible to never experience any discomfort.
Yeah, and you have to sort of manage through that. And a lot of times you might not know if you have structural discomfort unless you've sought out medical care before.
Right.
I mean, I'm sure you have clients who have arthritis or tears or what have you and never had an image and just sort of notice it just kind of being their balky knee or their creaky shoulder, whatever the case may be. So, yeah, I think in that case, a little bit of discomfort that we can manage and relieve, I think overall constructs for even if it's from a joint driver, that pain, if you're able to construct and work and sort of overcome that, then hopefully in the long run you'll insulate yourself from having more of these sort of dips in your well-being.
Yeah, and on that note, kind of again on the pain, I have had clients over the years, and actually I have arthritis in my right knee, so I understand this. You have some good days, you have some bad days. And a theme that's popped up a lot is if you're experiencing like a bad day, just like, man, if normally I'm at a 3, I'm at a 9 or an 8 or whatever. Sometimes there's, like, as far as I see it, this interesting phenomenon that the days that sometimes are the worst, where you're thinking, all I want to do is rest, if you find a way to move, oftentimes the hour afterwards or the whole day afterwards can be almost like a reset, right? Like, felt terrible, got moving, maybe even worked through some discomfort, and now I feel so much better. Do you think that, for one, is that something that you've seen where, and if that's the case, what's happening?
So, yes, I have seen that. And I think, part of what we do best for our patients and our clients is we arm them with education and understanding about how their body moves and what they can do to be in control of their symptoms. So, when someone's in a lot of pain and you're able to overcome that, I think there's a couple things that are happening. Oftentimes we can improve a bit more of that sort of some circulation, improve sort of joint mobility. If there's sort of stiffness or creakiness, you're allowing for better sort of fluid movement and whatnot just by getting moving again. If you're static, nothing's happening. You're lying down being still. And I think there's also a sense of empowerment of your own symptoms. We know what benefits exercise has to make you feel better, but I think just the active thought of I'm doing something constructive in of itself makes you feel better. And so much of that sort of has an effect on our overall body. I mean, our limbic system, which controls our emotions, is plugged into, our neurology. And so when folks have these chronic pain issues, your body sort of associates that with not feeling all that great. And so I think when you...
That's interesting.
Yeah, that's super interesting.
Yeah, so, I think that's why... things like gentle, low-impact movement are great for folks for things like my fibromyalgia, for example, which is, a challenging diagnosis to overcome because it can be unpredictable in its whole body and you don't want to move. And so, we encourage those folks to be moving with low intensity. We don't want to burn them out because that can feed into and aggravate symptoms. But if, again, the empowerment to say, hey, if you're having a tough day, here's how we can overcome it with some of that kind of gentle movement. We have that overall effect on our, musculoskeletal and our neurologic system.
That's the human body and the brain is just like...
Pain science is endlessly fascinating,
I do always notice I'm in like a bad mood when I'm getting like a flare up of some kind. Like, like if my neck is sore or something, it's like it affects my mood.
So it's almost like there's a combination then of one, better circulation, so the synovial joints are getting more fluid, right? Maybe blood flow is helping heal or whatever it's doing, warm the area. And then to your point with the limbic system, it's almost as if, I think I've heard this somewhere before, that serotonin can almost have like an analgesic effect to an extent, right? Like like if you're pumped full of like this good feeling, maybe you're less likely to feel that discomfort. Is there any sort of analgesic response to exercise or just moving in general?
Analgesic response. So, I think that our body does prioritize different kinds of tactile and physical stimuli over painful ones. And so it's the mechanism, for example, things like electric stim or massage work through, is that your body will prioritize those sensations over painful ones. Something called the gate theory, which is, still taught a little bit. I think it's being challenged some, but essentially, you ever bang your shin on something and you kind of rub your shin, you're like, that hurts.
Yeah.
It makes it feel better, right?
Yeah.
Because your body is sort of saying, hey, focus on this sensation.
Your attention is going towards
Exactly.
it.
Yeah, and I wonder if it's a similar mechanism to what you're describing there, where sort of that overall movement and that comfort is sort of re-racking your neurologic priorities, essentially. This is just speculation, to be perfectly honest, but just kind of thinking through what I know, that would be something I would lean towards.
And it's probably accurate to say there's still probably a lot of speculation around a lot of the human body, right?
100%. I mean, again, I've been out 17 years, and a lot of the things that I've learned have been sort of updated or are now no longer appropriate because we've come along and we've learned more.
Yeah.
I joke it's what we call practicing medicine, because no one's perfected it yet, right?
That's kind of good.
And I tell a lot of folks, if there's ever a day you think you know everything, you should retire.
Yeah.
Because we're always evolving. I mean, it's why we take coursework and maintain our licenses. And
goes for a lot of things, though.
Oh, for sure.
Yeah.
And I think if you have a passion for it, you're going to seek those things out organically, right? I mean, I know that we've talked about different techniques and approaches and swap notes before because you want to learn more because it's always evolving. And I think that's the healthy mindset you have to have, is that if you don't challenge your notions of things, you're not doing your patients a service or your clients a service. There's always new and unique ways you can try to do things. You don't have to get overly creative. I mean, I see some of the exercises like on Instagram, and I'm like, what are you doing there, bud? Like, you don't need to be so novel, right?
Yeah,
but I think there's just it's good just to challenge just kind of how you do things and just take a moment once in a while and go, why am I still doing it that way? Is that the right way? And the answer might be yes.
Yeah.
But it's good just to think about that.
Yeah. Well, and that's why Dr. Joe's the best.
Oh, geez, you're very kind.
But yeah, when you talk about the novelty about it, I kind of refer to that as just getting cute.
Yeah.
It's like, what are we really?
Right.
What are we?
Well, because
really
you want to be
doing
flashy. You think, well, if I'm doing this thing that involves 4 bands and 2 balls, the patient's going to say, or the client, wow, this guy really knows what he's doing.
Yeah.
But the inverse is probably like, why am I doing this?
Less effective. Yeah.
Exactly. Yeah, you're sort of fighting yourself.
Yeah, exactly. And don't you find that? Well, I found this in my experience that, forget your clients for a second. As far as like learning new things, I find I'm the most excited about my work day when the programming I'm doing for the day or the twists on certain things, even if it's just something minor as far as changing tension. Mm-hmm. Those are the days I'm the most excited.
Yeah.
Because I'm learning and I'm evolving, and I think my clients will feed off of that. Whereas, to your point, those times where maybe I've been slacking a little bit as far as my own continuing education, and maybe I'm less enthusiastic as I'm writing up my program.
Sure.
I would almost imagine those are the days where maybe I do a good job of like working through that because I've been doing this for a long time. But those are the times I imagine I'm like, do they know? Do they know this is a sucky workout?
He didn't have his fastball today.
Yeah.
But that's our challenge as professionals, is that, for us, it's Tuesday, and for our patients and clients, like, this is something that's out of their day, they put on their calendar to come in and see us for. And you gotta slog through it.
Yeah.
This is why I drink the caffeine that you're trying to cut out, right? But that's part of it, is you have to remember that this is novel for them, right? And so this isn't, you might be they might be the 12th client of yours for the day or whatever, but for them, you're their trainer.
Could be the only
That's right.
thing they got going on that day. Yeah,
Exactly.
it's true.
So I'm being selfish right now. A lot of the questions I've asked so far, actually all of them have been my questions. So eventually...
Well, you're the host, so you get to do that.
Eventually we'll get to other people's questions. But I have one more, and this actually does tie in. It'll be a perfect transition into some of our clients' questions.
Sure.
So one of the themes of when we asked our clients, hey, we're having Dr. Joe on, do you have any questions for him as far as PT and just in general? One of them, or actually a consistent theme, was this idea of sitting throughout the day And everything from, hey, what are the best stretches to combat sitting? Or, is there a best time of day to stretch? Or is there, a certain way to approach posture? There's all these different ideas of having like a bolster in your chair, or an ergonomic chair, or standing more, right? There's all these different ideas. So we'll get into that second, but my question that it's almost a hypothesis, right? I've been speculating on this for a while, and I'm curious, right? You can maybe debunk me right now. Okay. So, I'm being vulnerable, guys. So I've had this thought that when how you talk about being bedridden, mm-hmm. and, they say, oh, well, if you're bedridden for X amount of time, you could start atrophying, the body could start prioritizing not using those muscles that are basically not being contracted. That's a mechanism that exists, right? Mm-hmm. The idea that if you're not using muscles, the brain will just kind of rewire and go, well, I guess we're not using that. That's kind of the idea behind synergistic dominance, right? It's like you're overpowering these other muscle groups by finding different pathways to do a movement, mm-hmm. right? So for those who don't, synergistic dominance would just basically be something like, you're doing a movement like a pull, like a row, which should use a lot of your big muscles like your lats. Instead, all you really do is feel it in your biceps, which is secondary supporting cast to the lats, right? That would be that fair explanation. Yep. So my theory has been, or what I'm concerned about is if you have a person who's been sitting for 8, 9, 10 hours a day, right? They come to a workout. Is there a brief period or a brief window where after they're done with their workday, their muscles like their transverse abdominis or other important postural or core stabilization muscle groups are inhibited because they sat for 8, 9 hours?
So I think the short answer is probably, I'm gonna say yes, kind of.
Okay.
This is what I'm thinking of. So there's something called crossed upper quarter syndrome or lower quarter syndrome, and so what that means is that essentially these adaptive changes that we have to our body from kind of consistent positions, and let's pick on sitting for a little bit. Mm-hmm. We know because most people who are sitting are working, so they're on a keyboard, a phone, whatever the case may be, and so they're typically here. And so we have this learned posture of having contracted muscles in front, lengthened muscles in the back.
Yeah, like this.
Exactly.
Yeah.
And so what that does over time is that it can inhibit some of those lengthened muscles because, again, we've now these shortened ones are now more kind of active and turned on. And in our neurology, we're going to inhibit our antagonists to allow for agonist movement muscles to happen. So, for example, if I bend my elbow, my body needs to inhibit my triceps to stretch. Kind of the same thing. So the question, I guess, is, and I don't have an answer for this, but we're sort of going to talk it through together, is if you sit for 8 hours a day, how long does it take? Or can you sort of maintain the same level of strength if you jump into a workout using those inhibited muscles versus if you sort of hit it on a Saturday morning when you weren't sitting?
Yeah, that's kind of the idea. So for example, again, this has been my hypothesis, right? And so oftentimes when I do have my afternoon clients, I will, just to be on the safe side, start with something like a Pallof press or mm-hmm. a bird dog or mm-hmm. something that's going to just wake up those deep core muscles, because I know it can't hurt, right? It's not like the workout's going to be worse because I had them do like core stabilization stuff first. But I guess, do you think there's any credence to that possibly, like, it may not be wise to go from sitting 10 hours, you just finished your workday, mm-hmm. and then maybe you warm up how a lot of people warm up, which is either not at all or
I will say I'm always amazed at the amount of times I have people who come in to the gym and first thing they do is they go right over and they start doing like cable flies. With weighted cable flies. I'm like, how? Maybe because I'm getting older. How do you do that?
Yeah.
I mean, I need 20
especially
minutes.
Those muscles that are usually more tight.
Oh man.
The chest muscles,
Yeah.
Yeah.
But I think so. It would be an interesting thing to research on. I think my advice would be to somebody is to do kind of what you're recommending, which is that whether it's with you guys or with me or on your own, is to, if you have been sitting all day, I would certainly make sure that your warm up, whatever you choose for it to be, to involve something that sort of moves counter to the position that you've been in for 8 hours.
Yeah.
Right.
Yeah.
And I think if you also maintain your mobility throughout your workday with some different handy tips and tricks that we'll talk about soon. I think that'll also that may also make that a bit easier as well, because aren't as accustomed to that static position for long periods of time.
Okay.
Yeah.
Yeah, because that's kind of, again, been my hypothesis that it may not be wise to, again, you sat for 10 hours, 8 hours, and then
go right
you
into
just,
like a compound
like
lift
a
or
deadlift
something.
or a heavy squat or something.
Yeah.
Where you really need that core stability, right?
Mm-hmm.
The whole lumbopelvic hip complex needs to be pretty dialed in and taught to protect the spine
for a complex movement like
right.
that.
And so
Yeah.
that's, I guess, what my hypothesis has been: scenario A, scenario B. You have someone who comes in, they sat 8 hours, they go straight to deadlifting. Maybe they walked on the treadmill for a few minutes. Let's give them a little credit. And then person B, they do the treadmill, they warm up, and then maybe just do a couple course, to your point, an opposing muscle group or opposing movements.
Yeah.
Sitting is often this, right? Maybe get some thoracic extension in, do some core activation with something like a Pallof press or something like a bird dog, something like that.
I like hip stretches a lot too.
Yeah, true, right? Because this is all getting shut down too, right? The glutes are basically taking
that's
a
the lower
vacation.
quarter cross syndrome, basically, sort of the opposite of that, same thing.
Okay.
Yeah, the glutes are basically on vacation, right? Most of the day.
Yeah, they
right?
get smushed all day.
Yeah, so even that, right? Like possibly pre-deadlift, like in this scenario, do a bird dog, do a glute bridge, get some thoracic extension. Mm-hmm. Do you think it'd be logical to assume that second scenario is going to prepare you better for compound lifts?
I mean, my knee-jerk reaction is to say yes, because you're engaging in some kind of sort of mechanism by which you're getting your neuromuscular system ready to go, versus someone who comes in off the street and just jumps into deadlift. Now, the other variable there is a difference between someone who comes in after an 8-hour workday of sitting versus an 8-hour workday of standing and moving around. And
yes, clarification, I'm talking exclusively about sitting.
Okay, yeah. So I think in that instance, I think it would be wise to do something like you're describing, where you're using some warm-up activity that involves getting those extensor chain muscles and all those ones that probably have been inhibited throughout the day just based on your position. I shouldn't say inhibited, because they are working to hold you up, even though they're not at a mechanical advantage to do so. So let me clarify that to say working on exercises and movements that get you through opposing range. Let me say it that way.
Okay.
And I think that way then you're more prepared to move that against resistance, like with a deadlift or a row or whatever the case may be.
Okay.
Yeah.
Yeah, that makes sense. Do you have any questions on that one?
It makes total sense. And that's what I know. You try to do that in the beginning of sessions. I do the same thing.
Yeah.
Because I always just thought that would be best. So.
Yeah, well, I feel like what I've been trying to do for a while is not demonize people for sitting, because I know I'm lucky. I know I'm lucky that I get to make a living and I stand and basically hang out with people most of my day, right? So I don't have to worry about that. Mm-hmm. But in some ways, I want to demystify the idea that sitting 8 hours is normal, right? It's not a normal thing as far as how our body perceives it.
Well, let me reinforce your point with something I kind of noted over the years. So I think it was like 10 years ago, I started hearing the phrase "sitting is the new cancer." It's the worst possible thing for you.
I've heard that.
Right. And so,
or the new smoking. I've
exactly,
heard.
same
Smoking.
thing. Yeah, it's awful for you. Which I think is a bit dramatic, but fine.
Yeah,
let's take the point.
Yeah.
So we started seeing an evolution of like standing workstations and people sitting on Swiss balls and all these different things to get you out of the chair, because that's the thing that's going to be bad for you. But then people were standing for 8 hours a day and having back pain and knee pain and hip pain from standing all day.
Yeah.
And so I think the challenge there, and what the sort of conventional thinking has moved to, is that static positioning is not what we're built for, to kind of reinforce what you're saying.
Keep moving.
We are creatures of movement.
Yeah.
We're designed to be moving around.
I've heard that before too.
And so I think, whether so if folks have the ability to have a workstation that adjusts, I would tell them alternate, sit for an hour, stand for an hour, or break it in half, or whatever the case may be. Some folks don't have that luxury, like you said, and people got to work.
Yeah.
But can it even be like being seated in different ways? Like you saw, I just raised my leg here.
Yeah.
I set back a little bit. It's
Almost
just a constant. Yeah, it might be fidgeting.
Well, I think that
Nico's like, this is the answer,
yeah,
guys.
that's right. My thumbs are incredible. Look at these forearm muscles. My AP. No, but I think the difference of what you're describing is that when I always sort of chuckle whenever I would be in class or in a lab or something, and anyone talks about posture, I look around the room, everyone immediately does this.
Yeah, right away.
Yeah. And we all did that exactly. But inevitably, we're using a different set of muscles to achieve that position. And once you get back to the minutia of your job or the lecture, then you're right back to where you were, right? Because it's a different set of muscles that are holding you up, or prioritized, I should say. And so you have to sort of make those muscles feel more well done. You have to make those muscles kind of feel more normal in I'm going to use this in big air quotes, ideal position. And so, the advice I give people who sit for a living is I give you 1 to 2 rules, whatever fits your day better. There's a 50-10 rule. So every 50 minutes you sit, you stand and move around for 10 minutes.
Every 50?
50. And
okay.
Yep. So you get up, you go to the bathroom, you take a lap.
Just get up and
we
walk
just
around
got to
a
get
bit.
you a change position.
I like that.
Because the other rule is the 20-20 rule. So for every 20 minutes you sit, you stand and stretch for 20 seconds.
They're both the same amount of effectiveness?
I have no research
in the ballpark.
Okay.
I mean, basically,
Roughly.
my only reason I give people options is that some people have the ability to get out of their chair and do a couple
don't.
stretches, and I'll show them a little chin tuck,
That's
a little back
interesting.
extension, a little shoulder stretch, pop your butt back down and get back to work. And again, it's a soft rule. You don't have to set a timer.
Right.
But I've had patients who will put a sticker on their monitor, and every time they make eye contact, that's my cue. Let me stretch real quick, and then they get back to it. And all you're doing is just giving yourself some little movement snatch throughout your workday. Now, for other folks, you might not be able to do that, right? You're deep in a task, and so people who get embroiled and working on spreadsheets or coding or whatever the case may be.
Meetings,
You probably have to physically stop yourself, and most people have Apple Watches or something that will tell you to get up. That's your cue to go hit the head or get a drink of water. Any workplace that doesn't let you pee, it's probably not a great workplace, right?
A bigger problem.
That's right.
Illegal.
Exactly. So, I mean, it's an easy way for you to get up and get your steps in and just change that stress. It's just the folks who are chained to the desk for 4 hours and then they sit to eat lunch and then they work for 4 hours that are going to have more to overcome, most likely, right? And so, and I think the more you also just sort of get in someone's mind that let's keep you moving, let's keep you active. I think it's going to be an easier transition to mobility sort of program through exercise in their life anyway, because you're making that part like a non-negotiable in your day. So you need to be a moving person.
Yeah.
And I think that has sort of through lines everywhere else too.
That's awesome, and
It makes total sense.
I'm gonna steal that for sure.
Steal it. Yeah.
So the takeaway then is, while it may be true that sitting is probably not good for us, it's maybe the overarching point is that not moving is probably.
I think that's the more specific way to say it.
Not moving.
Right, because I mean, I don't want people to feel guilty sitting down.
Of
right,
course
but I think
not.
it's everything in balance.
You got to do what you got to do.
Right, everything in balance. So as long as you've gotten your steps in for the day, and then you want to sit for an hour and watch television, enjoy that. You've earned that sort of thing, right? As opposed to that just sort of being your normal.
Yeah, because I think the tendency can be to go to extremes with that, right? You hear that, you have to have proper lumbar support and you need to be, engaging your glutes or whatever, right? Whatever you've heard anywhere, right, as a just general wisdom about posture throughout the day.
Right.
And you could go to these extremes. So one of the suggestions I've given to clients is just to view bad posture and bad movements, maybe bad's not the right word, but just like less than optimal, right? Sitting for prolonged periods of time. Maybe instead of just sitting with lumbar support at the couch while you watch your movie, right? Just enjoy it. And just view it as like a treat, right? And just like you may not want to eat cake every single day, but you can eat it every once in a while, right?
It's got room in your diet, provided you've accommodated for it elsewhere.
Yeah, so similar here, right? Like if you've walked a decent bit of the day and you do exercise and you try to move throughout the day, it's probably not the end of the world to just slump into the couch at the end of the day and just kind of enjoy that. I mean, moderation is key, right? And the individual knows to a sense.
Yeah,
right?
and I think that's when the more you work with folks and teach them those sorts of things, that becomes easier. And I think the one caveat is if you're seeing someone like me, you're probably dealing with painful symptoms, and there might be some more specificity there. So that's when you seek out a PT and have that conversation with them to kind of get you to that point where then you can moderate your own symptoms.
So summary, movement is the key, right? Not whether you're standing, sitting. If you're just not moving, it's probably not going to be ideal. So finding a way to incorporate movement in your rule for those who are asking for a way to kind of get through the workday and improve, keep their posture and just general sense of well-being up. It would be for every hour, you're basically of that hour, 10 minutes of movement. Or if you can't do that, for every 20 minutes, you move around and stretch for 20 seconds.
Yeah, and I show people 3 quick stretches. Basically, just a little chin tuck, hands behind the back, squeeze the shoulder blades together, little back bend with a butt squeeze, sit back down. Because you basically just counter hips, shoulders, and neck that get sort of stretched in that position.
Okay.
Real quick and easy.
So activate these muscles.
Yep. Hands together, squeeze and pull.
Just kind of stretch everything back.
And then stand up and do a little back bend with a butt squeeze.
Oh, okay. So standing up, so you'd be doing something like this.
Pretty much.
Okay.
Leading with the hips.
Leaning back. Again, trying to counteract all of the things.
Those in sitting on your butt.
Makes sense.
Simple as that. Yep.
That's awesome.
Yeah.
Okay, well.
I love those.
Those are some of the best stretches right there.
I'll be using those as well.
There you go.
Yeah.
Yes. After this recording is done.
Yes.
Yeah.
So
I might just do it right now. These stretches.
Please do.
So, okay, perfect. That actually was great because one of the questions was a consolidated stretching protocol.
There you go.
So as far as sitting goes, that's it.
That's it.
Well done, Dr. Joe.
Thank you. That was easy.
Yeah.
We're knocking it out. 2 birds with 1 stone. Now, speaking of, one of the other questions was a best time of day to stretch.
Mm-hmm.
Now, I would imagine that that's probably unique to individuals at times, but in a general sense, is there a time that the body responds best to stretching?
I would think it's probably easiest, or probably you'll get the most sort of bang for your buck, kind of the later in the day you get your stretching program in. And I think the main reason is just because you're probably just a bit more limber and warmed up at the end of the day versus the beginning of the day.
Yes.
I would say if your goal is sort of improving muscle and tissue extensibility to get you moving around, to be more flexible.
Yeah.
Say it in English.
That's a great point because it probably, what are we trying to accomplish
Right.
with stretching?
I have some patients, I get a lot of patients who, as we get older, and are dealing with things like spinal stenosis and arthritis and things. There are some stretches I give people to do before they even put their feet in the ground. So as soon as the lids are up, do a couple of these 3 or 2 stretches, and then get yourself out of bed. And those are some things that people do just to get them moving. And a lot of people say, like, I can't get out of bed unless I do these, but once I do, I can. Right, so there's kind of stretching, I think, sort of the context matters. But I think for what's being asked here, it's probably more about just kind of a general mobility program. How do I make myself more flexible?
Yeah.
And I would say the end of the day is probably going to be a bit easier just because you're more warmed up. I mean, your muscles and whatnot don't have as much blood flow going through them because your body's consolidating everything to the important parts.
Yeah.
And nothing's being activated and needed. If you're walking around, your body will open up blood vessels and send nutrients and oxygen to help your muscles go. And so throughout the day, that's happened more, innately. And so when you then go to stretch, they're kind of warmed up and ready to go. So I would say if someone asked me that question and I built a program for them, it would probably be for something later in the day.
Okay.
But to your point, if all they got's the morning, do it in the morning.
Yeah, the best solution is the one you can implement, right?
Yeah.
Mm-hmm.
That's interesting. So I've also heard that some people, gosh, I heard this years ago and it might have been total BS, but like stretching before bed can be effective because when you go to bed in that relaxed state, your brain can almost like take that programming over the course of the 8 hours. Dr. Joe's BS meter's going up.
I saw that in the eyes.
He's being nice to me.
Yeah.
That sizzling sound is me trying to think. No, I'm thinking through it. So I'm thinking through that. I think if I had to guess, I would almost think of it as more of a, I'm not going to say meditative state, but I think you're doing something to sort of kind of wind and calm your body down, sort of introducing a state of stillness, right? It's the same reason that a lot of the current recommendations is looking out for blue light and not looking at your phone an hour before bed, those sorts of things. So you're having the counter effects. You're doing something just to sort of give yourself, some you time to think through some stuff and kind of settle. I don't think I'm not sure if the mechanical act of stretching is going to help directly with sleep. However, I think that the ritual of that probably has some benefit to make sleep a bit more easy because you're doing something sort of in a calm way.
Yeah, slow everything down.
Yeah, I can't say for sure. I don't want to say that doesn't exist because I don't know. But that would be my suggestion to that.
So it sounds like if they're, as far as increasing flexibility because it's being programmed, but when you're going to sleep, it sounds like that might be just kind of far off speculation. But as far as stretching and getting in a meditative state before bed, more for the enhancing sleep quality, there's something to that
It's like
potentially.
the routine of it.
Yeah, yeah, exactly. I don't think there's anything about the timing of it that's going to make you more flexible versus doing other times of the day outside of what we just discussed with just things being more amenable to being stretched, I would say.
Okay.
Yeah.
Awesome. Yeah, That makes total sense. And
I know I like to do stretches at night, so
Sure.
I definitely resonate with that.
Yeah.
well, I mean, and when you listen to if I've had trouble sleeping before and done like a guided sleep
You have
meditation.
small children. Of course you have trouble sleeping.
Yeah, exactly. But when they guide you through it, a lot of it is contract, relax. Hey, contract, squeeze your neck and then relax and then squeeze your.
Yeah.
So it is this idea that a contracted state of being is not exactly conducive to sleeping.
Sure.
Right. So yeah, just getting more relaxed, that makes sense. And that's part of, I think, the mechanism for why people sleep better when they exercise. Mm-hmm. Right. Again, having kids, I think of, if Jamie doesn't get enough activity during the day, it's like
Forget about it.
hell to pay when we put him down.
Right.
Because he's basically just going to
Yeah.
look like he's in a straitjacket while we're watching the baby monitor for about an hour or two. But the days that he gets a lot more activity, tends to go into sleep a little bit easier.
Absolutely, yeah.
And I'd imagine that doesn't change as we get older too much.
No, it's just that we're sort of forced to be in lifestyles that don't allow us to move very much. Versus,
Yeah.
when you're a toddler, you're just a tornado running around your house. And so,
Yeah.
Because they don't care.
Yeah.
Because
Yeah.
it's a blissful time of life.
It is, right?
Yeah.
So, okay, great. So I think that pretty much wraps it up as far as like the questions around the basically how to get through the workday, how to combat having to, sit more often, some consolidated stretching protocols. Those were great. Well, actually, one I just missed, which is a perfect segue to what we were just talking about. Is there a best sleep position?
Ooh.
Because you hear things like, oh, don't sleep on your stomach, or
Right.
if you're going to sleep on your side, don't have a hard... There's all these ideas, right? But have you seen anything that actually has maybe some clinical backup to it?
The short answer is, the very short answer is no. And I laugh because my wife used to manage a furniture store, so you would think this would be a perfect opportunity for my wife who made commission to go, you should go to this store and get this specific mattress.
Time for the plug.
I never used my powers for evil like that. I think and I've heard the don't sleep on your stomach thing a lot, and I think the reason that can be provocative, and this is somebody who wakes up on his face every morning. Right?
This is me, by the way.
Yeah, exactly. Is that, a lot of the adaptive changes that occur in our body, whether it's from stresses or just from aging, tend to preclude things that make extension positions harder to achieve. And so then when you lie flat, you're sort of forcing your body in a direction that doesn't normally go throughout the day. It's the same reason like when you're older, some people don't like to lie on their stomach and they have like pillows under your hips because you're introducing hip flexion. In there,
Yeah.
or if your shoulders are drawn forward, then when you're lying down, you have all the more pressure kind of on smaller surface area in your front. And so I think it's because of that and sort of the load that your body has to then deal with makes that position more uncomfortable. So it's not that the position is itself is harming you. It's just that the way your body has sort of adjusts and adapts over the years makes that position harder to achieve. So, I don't often tell people to fall asleep on their stomach per se, unless they have honestly, they have acute disc herniation. That's probably the only position they can sleep in, is lying flat on their face. And that's usually a condition of younger people anyways. So the rule of thumb I give people is you got to get to sleep. And honestly, once you fall asleep, you're probably going to thrash and roll around different positions anyways.
Yeah.
And I've had it before where I've had folks who come in with acute back pain, day or two old. If I find them a position they're comfortable in, I will prop them up with pillows and I will turn off the light and give them 30 minutes to take a nap. Because that is a functional activity and gets them to rest, which they probably haven't done since they hurt themselves. And now we've also taught them how they can sleep. So, whether you sleep on your side or on your back, it's kind of up to whatever you're most comfortable with. The only advice I give people is that, much kind of like I would do for people who sit a long time, is once you lie down, feel for gaps. If your body isn't touching something, it will inevitably sag until it either hits something that supports it, or you hit a barrier of your own body, a ligament or a joint capsule or a muscle that basically now is holding you up. And that over a sustained period of time can be troublesome. It's like when I tell patients, I'm going to poke on you for a second. Like if I do this means nothing to you right now. If I do this for 30 minutes, you tell me to stop.
Yeah.
Right?
Yeah.
And it's kind of the same thing. Like, lying without support for a few minutes doesn't really mean too much, but ask your body to do that over 30, 45, 60 minutes. That can start to be a bit of a challenge because your body has to rectify that position. So lie down, feel for gaps, and wherever you feel a gap, prop it up with something. So like people aren't sure about contour pillows. I'll take a long towel and put it in the bottom of the pillowcase. So when they lie down, the towel's kind of in the crook of their neck.
Okay.
Just to prove a concept. And if they find that's helpful, then you can invest in a contour pillow. that sort of thing, or pillows between the knees and that sort of thing. Just make sure, because when you're lying down, your knees are touching, right?
Yeah.
So if you have a pillow between your knees, that gives you more sort of normal positioning of your body, essentially. Okay. And then people can usually fall asleep at that point. And then from there, it's kind of like, all bets are off, because eventually people have pillows in their bed, under their arm, between their knees, and then they're on the floor by the morning. But at least you've gotten to sleep, right? And
so the idea is just filling the space. As far as just making sure, in particular, I would imagine probably your neck, your head.
Your neck, your head,
has support.
And the knees, and then, if someone has wider hips, for example, maybe underneath like their hip, if they're lying on their side.
So if you get the sense that part of your body is somewhat suspended,
that's good.
Then trying to fill that gap.
And not to overfill. Like, we don't want you to be propped up way too much the other direction.
Then
Just
you have
enough
the opposite problem.
Exactly. Just enough to kind of bridge that gap.
Okay, that makes, and I love how just simple that is. It doesn't have. It's not as.
It's so complicated. There are so many mattresses, and someone mentioned like a purple pillow I never heard of. I can't keep up. There's so many brands out there, and firm, soft. I don't know. There's just I know a lot of my patients who prefer a firmer mattress when they go to like hotels are miserable because it's like sleeping on a marshmallow at the Hilton, right? It's just everyone's a little bit variable. I guess I would say, very generally, people seem to like something a bit more on the firm side.
Yeah.
Because again, it offers more of that support versus a super soft mattress where you kind of slump into it. But if you sleep best on it, I had a guy last week who said, they were at their friend's house at a lake house, and they were sleeping on an air mattress. He said the best sleep they had in months on an air mattress. That's the thing, right? And you would think it's an air mattress, it's going to stink. Not necessarily. Yeah. So that's why it's hard to say. I don't go out of my way to recommend a brand or a type, because I don't have any confidence to recommend that to somebody. And that's an investment. That's a lot of money. And I try not to get people to spend money. Let's homebrew a way we can kind of get the job done.
Yeah. Well, speaking of investment, as far as kind of being more on the firm side, I've heard that firm mattresses last longer too, because the soft ones are built to you can kind of see how they'd cave in a little bit sooner, because they just don't have as much of that structural integrity as maybe a firm. That's what the guy at Mattress Firm told me.
I'm sure.
As he sold me my expensive mattress.
I'm sure he's very happy to sell you that mattress too. Yeah, I could say for sure, but possibly.
Yeah, but also to the point of the air mattress, it sounds like just, hey, if you wake up with pain on a regular basis and you didn't have it when you were going to bed, that's probably likely that something to do with your sleep position is maybe not going quite so well. But whether or not you have a firm mattress, you're on an air mattress, a soft mattress, stomach, back, side, if you wake up feeling pretty good, it's probably, for all intents and purposes, things are working out fairly well.
I give the same advice to runners for their shoes. It's like, when am I supposed to change my running shoes? Like, well, if your shoes, if they hadn't hurt you and now they're hurting you, it's probably time for a new pair.
Yeah.
Because I've heard the recommendation on mileage, 250 miles, 500 miles. But I just tell them, run until it hurts. If it starts bothering you, then get a new pair.
Yeah.
Right? And then carry on.
Yeah.
Yeah.
One of the things I want to give you kudos for, as far as the, you having that one client just maybe take a nap for 20 minutes, is I would imagine some more inexperienced physical therapists would maybe think of that as like, oh no, that's not a good use of my time. I need to be treating them, right?
Right.
But the way I see it is, your goal is to help them, right? In whatever capacity it is, you want to help them be more healthy, experience less discomfort. Mm-hmm. And why wouldn't you want to properly help someone leverage something you're doing a quarter to a third of your life?
Right.
Right? Mm-hmm. You can be doing all of these things, right? Like I talk about that way with exercise, as far as people who are trying to be more considerate of posture and joint discomfort and things like this, right? We can create some momentum in this 1 to 2 hour window with exercising, right? But if you don't carry that momentum out into your life with having relatively good posture, staying moving, right? Sleeping enough at night, like all these people who are wondering what's the next big greatest supplement to help them build muscle, but are sleeping 4 hours a night, especially young guys, right?
Right.
Life's too exciting, so you don't really want to sleep. And again, you're thinking of, how can I get as big, as strong, and muscular as possible? Sleep more, right? Like sometimes the most simple solutions are the best ones, right?
Well, especially because for a lot of young people, they're also sort of pushing the concept of grind set, right? You got to use all 27 hours of the day to get your small business off the ground and get your other job going. It's like, just relax.
Yeah.
Yeah. It's just, I mean, you can get those things done and still give yourself some rest, because then otherwise you're going to be burnt out by 30 and miserable.
Yeah.
So
yeah.
like you need to find that balance, and sleep isn't flashy.
Yeah.
Right. So it's not fun to talk about because you're literally inert.
Yeah.
Right. But that's it's an important facet that's underutilized, and in healing just as much as it is in hypertrophy.
Yeah, it's human nature to want to look for that magic bullet, right? And actually, I just was having a laugh with my last client because she's like, "Do you think I should do one of those things where it shakes your tummy?"
Oh God, Danny! Oh God, Danny!
And so I go. Listen, I understand why you're thinking of that, but you're trying to get outside the normal parameters of what makes people successful in just being fit, reducing body leaning up, etc. with the magic bullet.
Yeah.
Right? The reality is move more, strength train to maintain your muscle mass, and if you're trying to lose weight, just burn more calories than you're consuming, and it's hard to really get too far outside those parameters. But people still try to do it.
Yeah.
It's my pet peeve are basically all these devices and products that their end goal is to make themselves a bunch of money.
Yeah, for sure.
And they're all and that's the challenge with
because they know that. They know people want that magic bullet.
Well, especially these days, because I remember when those devices came out, and this was before like social media was as omnipresent as it was, and now all these different companies can get at you so easily, and make a bunch of claims that they don't really have to answer to.
Kind of pull on your heartstrings a bit, your insecurities and stuff.
Absolutely, it just drives me crazy because you're taking advantage of people that way. But because the sustainable path is exactly what you described, but it's also the hardest one.
Yeah,
because I think a lot of people want that sort of magic bullet, but then continue on with life the way that they're like, I want to do what I'm doing now, but I want to look better.
Yeah.
Like, well, I mean, those
kind of not possible.
Sometimes it isn't, right? And so even if even if those things were to work, which they don't, but if it did, you would then backslide right to where you were because you haven't sort of addressed the causative factors that got you to a place where maybe you're not happy with, you're not as strong as you could be in the first place.
It's a lifestyle thing.
Yeah. Oh, that stuff drives me crazy.
Yeah, and like you were saying, sleep isn't sexy.
No.
Neither is necessarily, hey, be consistent with exercising, move more, right?
Yeah, nothing sexier than getting a food scale out. Woo, yeah, 100 grams of rice. Wow, watch out.
Exactly. So, and she mentioned how, it's been around. These have been around since even before, she's like, when I was a young girl. And I'm like, and in that time, I have never once heard of a fitness model who has the most ripped abs you can imagine attribute it to having the ab shaker.
Unless it was #ab, sort of thing attached to it.
Yeah. unless he's getting paid, right? Exactly.
Yeah.
So, but again, they're gonna keep doing stuff like that.
Stuff like that. That's hilarious.
So, does it do anything? You think like a shaker? I mean, what is it
say
even?
It does?
They say it like vibrates. I would imagine it's playing on stem to a certain extent, like electric stem.
Well, so there are the ones that actually theoretically contract your abdominals, right? That's the one. The other one, the ones that actually vibrate your body. I remember like those old black and white footage that people had those belts that like shake their bottom back and forth real fast. You ever see those before?
I think I've seen those.
Yeah, it's. I mean that's the same sort of concept essentially. So no, that doesn't do anything. And the electric stim one, yes, it will make your muscles contract. Certainly, is it going to make your muscles bigger? No. Is it going to make you lose weight? Absolutely not. Right. It's just, but a lot of those devices, whether it's a pill or whatever.
But isn't there belts too?
There's the belts. And they take what I find happens is they take a very small sliver of a proven or sort of accepted scientific concept.
They like blow it out of proportion.
And they apply it to everything with wide strokes. And you can't. That's not how research and science works.
Yeah.
Right? You have to be really specific on what your findings are before you can make these kinds of claims. You have to be able to reproduce that, and you can't just say, well, because it does this, it must obviously do these 15 other things.
Yeah.
No, that's not what research is built around.
Well, and they pick probably the heck out of that one study, right? Mm-hmm. And I was just having that conversation with a member recently. She was saying something about, oh gosh, canola oil is so bad for you. And one of the things I challenged her a little bit, and I just said, hey, listen, there's going to be fitness influencers and nutrition influencers and just influencers in general. And one of the things that they have the advantage of is they don't necessarily need to cite the meta-analysis or the studies that are backing up their claims at times. And so if it worked for one person or it works for maybe a few people, they can run with that whole idea of sugar is terrible for you and you just need to stop being exposed to Wi-Fi rays or like whatever it is, right? You can make these claims, right? And so what I was telling her is maybe some of this anecdotal stuff out there, try it. If it works for you and it's not necessarily harmful to do, then go for it. But there's a reason why, if you were to go to a hospital, they may not necessarily, like you're actually working with a registered dietitian, they may not be likely to just jump straight to, canola oil is bad for you, because they're going to be the ones waiting for the peer-reviewed studies, the meta-analysis, right? They're not necessarily just going to, because they're beholden to a different set of standards, they're not going to jump straight to just that thing that sells, right?
Oh, yeah.
Because just saying, don't do this one thing and that's going to reduce your inflammation, or do this one thing and that's what's going to stimulate weight loss, that's sexy.
Right. And you literally described the opening of every Instagram reel I've seen on fitness in the last 3 weeks.
Yeah.
Right.
Yeah.
I mean, how many just
do this one. Do this one.
Yeah. And I think the concept of bad foods is it demonizes things too much, because I think, again, like we talked about before, anything has its place in your diet as long as you sort of know what your targets are and you accommodate it elsewhere. A piece of cheesecake is good for the soul.
Yeah.
Just understand that if you have that, like, you got to think about what you had the rest of the day or the rest of that week, for example.
Yeah.
Think of it from those timelines.
Yeah.
And so is it full of things that are less healthy or more, more energy dense? Yes.
Yeah.
Right. Is it bad for you? No,
not necessarily.
If you've had it, if you've accommodated for it in the rest of the week. So
yeah.
I think that sort of binary good and bad label sometimes, then makes it even more taboo to eat foods. And when you do, you feel like, oh, I ruined my diet, and then you get yourself frustrated, and the cycle sort of continues anew.
Yeah, well, because the FDA is a lot of skin in the game as far as making sure we're not doing things that are going to be like extremely detrimental. So probably the only caveat would be trans fat. That would probably be the only thing we probably should not eat any trans fat. But yeah, I mean, so the sad conclusion to that is you got to work hard, guys.
Yeah.
Got to move, got to make some lifestyle changes.
You got to make that, it's got to be your lifestyle. Like it needs to be sort of a non-negotiable. This is what my life needs to look like. And then, that's the path to sustainability.
Yeah. So Dr. Joe, I told you I was going to give you a curveball.
Okay.
So this is from John. John is in his 50s. He's a successful CEO and not a 15-year-old boy. And he wants to know, if he were to pull a muscle during intercourse, which one would it be?
Oh, boy. Well, I did have a guy who needed a disc replacement in his neck because he was having intercourse. And her name is... So it's not as unusual as you think it is, honestly. And, we laugh about this. That's a legitimate question.
Yeah, that's what didn't I say that?
Because I had...
Well, Nico, you're kind of a freaky guy, so...
Oh, right.
But I had...
Why'd you say that?
No, you couldn't see Danny's...
Nico's like, you do it like I do, you're going to get injured from time to time.
Now, you can't see Danny's right eye in the camera, but he was winking when he said that, and I thought that was a little suggestive. But, I mean, I have patients after hip replacement, who can't put their hip in certain positions because you might dislocate it, and they need guidance on that sort of thing. And no one's talked to them about it before because it's taboo.
Because it's,
Yeah, and so, I mean, I've had that conversation with patients, male and female, to say you can be in this positions and you can't be in those positions for 6 weeks or for 12 weeks until that hip heals. And then you have no restrictions. You can go forth and carry on. That's a legitimate thing. And and not many people talk to patients about that sort of stuff. So I know it's a joke question.
Yeah, I don't think John meant it as a legitimate thing.
Well, that's why I tell John that he can come see me. We'll have a long conversation. I'll keep the door open, but otherwise we'll have a nice long conversation about it. And then we'll be able to be, he can go forth and have as much intercourse as he wants safely.
There you go.
Good job, John.
Good job. Well, actually, I was reading, do you know who Dr. Stuart McGill is?
Oh, of course.
Yeah, and so one of the foremost experts with back pain, right? Mm-hmm. For those who don't know. I read one of his books, and there actually was a section on that, right? Mm-hmm. For it was more of the Q&A thing at the end of the book,
right,
where he was talking about people who have these back pain problems, like significant, whether it be, stenosis or, herniated disc, bulging discs, et cetera, probably many things the names of that I don't know the names of, but, if you need to stay in a neutral position or have to avoid flexion or whatever, right? There's literally diagrams of this is what the position would be. And at first, my 15-year-old self was like, right? But then I'm like, actually, the more I think about that, this probably is a real thing for some people.
Mm-hmm. Oh, absolutely.
So John didn't intend it for it that way. But
I made a learning moment on it anyway.
Right?
There, John.
Yes, Dr. Joe, the consummate professional.
Yeah.
I'm thinking I'm going to get a little rise out of him. And he's just like, well.
He's like, I have a client. I have clients like this. Yeah.
Yeah, this is a real thing, guys. So.
I've been doing this long enough. I've heard just about everything. So I don't even ruffle my feathers anymore.
Awesome.
Yeah.
Well, believe it or not, that hour just flew by. So
Awesome.
And we didn't even get to that one question, the big topic. We'll get to that maybe next time.
Stay tuned.
Stay tuned, exactly. So, Dr. Joe, thank you so much for coming on.
Thank you.
Nico,
Appreciate you guys.
I love this 3. This was awesome.
It was interesting. Yeah,
So, thank you guys.
Thank you.
Thank you guys for tuning in.